So if you're thinking about having another baby, you may be wondering, should I see maternal-fetal medicine prior to getting pregnant or just wait until after I'm expecting? The answer might surprise you. For many women, the most important visit of the entire pregnancy actually happens before conception. Today, I'm going to explain who should schedule a preconception consultation with an MFM physician and how preparing your body right now before pregnancy can reduce your risk of complications later. If we're meeting for the first time, then welcome. My name is Dr. Jessica Poulin. I'm a maternal-fetal medicine physician, founder of Femme MD, and mother of 4. I help women through preconception, through pregnancy, and into the postpartum years to navigate this time with strength, confidence, and evidence-based medicine. Let's get started. What is a preconception consult? A preconception consultation is exactly what it sounds like. Instead of waiting until you're already pregnant to identify problems, we optimize your health before conception. During this visit, we review your medical history, discuss previous pregnancies, evaluate your current health, review medications, identify nutritional deficiencies, and address lifestyle factors that could affect your pregnancy. If additional testing is needed, we can complete it before you're pregnant. The goal is simple: create the healthiest foundation possible before conception so you can enter pregnancy in the best health possible for both you and your future baby. Think of it as giving your next pregnancy the strongest possible start. So who should see an MFM before pregnancy? Here are some of the most common reasons I recommend scheduling a consultation. A, you've had pregnancy complications before. If you've experienced preeclampsia, gestational diabetes, preterm birth, severe fetal growth restriction, placental abruption, stillbirth, recurrent miscarriage, or a baby with a birth defect, you don't have to assume the same thing is going to for sure happen again, but don't ignore it either. Many of these conditions have strategies that can help reduce the risk of recurrence to future pregnancies, especially when we have the opportunity to plan before conception. B, you have a chronic medical condition. This includes things like chronic hypertension, diabetes, thyroid disease, autoimmune disorders, kidney disease, epilepsy, heart disease, and obesity. Pregnancy places tremendous demands on the body. Optimizing these conditions beforehand often leads to healthier pregnancies, fewer complications, and healthier babies. C, you're taking medications. Many medications are completely safe during pregnancy. Others should be changed before conception. The goal isn't to stop medications on your own, it's to make sure you're taking the safest and most effective treatment before pregnancy begins. D, you'll be 35 or older. Advanced maternal age does make your pregnancy high risk. That doesn't mean you won't have a healthy pregnancy. Many women do. However, age increases the risk of pregnancy complications, chromosome abnormalities, miscarriage, and certain maternal health conditions. A preconception consultation allows us to discuss those risks, review your health, and develop a personalized plan to optimize your pregnancy before you ever conceive. Another reason is if you're struggling with your metabolic or your weight, whether it's obesity, insulin resistance, prediabetes, or difficulty losing weight after previous pregnancies. Improving metabolic health before conception can reduce the risk of complications for both mom and baby. If you're currently taking a GLP-1 medication for weight loss, this is also an important reason to have that conversation. These medications should ideally be discontinued before pregnancy, and developing a safe transition plan before you try to conceive is an important part of preconception care. Even modest improvements in metabolic health can make a huge difference in your pregnancy, so that's why it's important to talk about it before your pregnancy even starts. So why this matters? One thing I tell my patients all the time is this: pregnancy doesn't happen in isolation. It places significant demands on every organ system in your body. Pregnancy can worsen health conditions that already exist, such as chronic hypertension or diabetes. It can also create unique complications like gestational diabetes and preeclampsia, which don't always end when the pregnancy is over. We now know that these complications can have lasting health consequences between pregnancies and even later in life, increasing a woman's risk for conditions like chronic hypertension, type 2 diabetes, kidney disease, and cardiovascular disease. That's why optimizing your health before pregnancy isn't just about the next 9 months. It's actually an investment in your long-term health. If you're wondering whether you would benefit from a preconception consultation, there's a really good chance that you will. The purpose of preconception care isn't to wait for problems. It's to prevent as many as we possibly can by optimizing your health before pregnancy begins. If you found this video helpful, be sure to subscribe to Vital Femme MD for more physician-led education on pregnancy, postpartum recovery, and women's health. Take care of yourself, mama. I'll see you in the comments.